Hi, this video is the art of hair transplant restoration surgery on a black African American woman who flew in from Texas, and basically she has a receding hairline and frontal corner and all the way down to the temple and the sideburn. It's genetic. She's actually Kenyan, and so on majority of time this type of hair loss is genetic. Um, you know, you have to have the gene to be able to have this type of hair loss, and it's quite unique for black women. Yes, we understand traction alopecia, you gotta braid it, but not every black woman who braid lose her hair. Some of them do, because you had to have a hair loss genetic gene of this type of hair loss receding, and then braiding on top of it will accelerate the further hair loss faster. But hair transplant on black curly hair is very difficult. It's not only the hair's curly, the root is curly as well. So, if the clinic or the surgeon does not have a lot of experience on working with black curly hair, they will destroy quite a bit of the roots during the harvesting part, doing the dissection part, and doing the placing part, because it's quite difficult to manipulate with curly hair. Through many years of experience, and I've been doing this for a decade already, I have invented many of my technique and tools to overcome the difficulty of harvesting, dissection, and transplanting black curly hair, and thus and we have the good result after many years, and allow me to become a specialist on black curly hair. So the surgical skill is one factor, and that's determine the density, the exact size, how to the measurement, the hair follicle, the size of the site, how you make the site, and all that stuff is determine and help determine the density as well. But the exact science is the other factor, and the third factor is the artistic and aesthetic detail, and that's very important, because for women the hairline is very complicated. For men sometimes it's easy, it's straight out, go up and straight across, but for women it's not, and it's a lot more complicated. And no hairlines are the same, and so when I build a hairline, it's a unique hairline for each individual facial structure. Make sure it's overall proportional to a third and a third, and bring in the temple as well, because again, you're going to be wearing this and for the rest of your life, so you want to make sure the hairline is perfect. And a lot of time I follow the natural hair that the client has, but if she doesn't have it, I can recreate it as well. The angle on the temple, the temple where the eyebrows end, the temple begin right there, and the angle for men, Caucasian men most acute backward, Asian men less, black men is perpendicular, but for women it's actually pointing toward the middle. The zigzag is wider in amount and higher in amplitude. And then we transplant rows and rows single hair graft in the front, followed by root with 2 hair, 3 hair, and 4 hair in the back for bulk and volume. The precise angle is very important. Most women, black women, have the flat angle pointed backward, but for men, actually pointed forward. For black men, actually flat against the skin around 15 degrees. So the precise angle is very important. The selection of hair grafts is important. The shape and the size and all the stuff of the hairline is important. I'm very excited for her, because in a year time her look will change. We'll be attempting at least 2,500 grafts for her, and in a year time she will look different with a lower hairline and a full set of hair, and it frame her face better. It help accentuate the eyes, the nose, and all the features that God created. Now, no hair transplant is perfect, and it has its flaws, and one of the problem with hair transplant is sometimes for women, more often than not, you might need more than one surgery to have better density. For every 100 hair we put in, it's never going to be 100%. It varies from 70 to 90%. And again, it's dependent on the individual body as well. 65 to 70% depend on the surgeon. 30-35% depend on the client as well. And then you can always do a touch-up to have better density. Or as you lose the transplant hair permanent, but as you lose further hair behind it, then you're going to need another touch-up one. The other important factor is what they call the little lumps at the base of the hair follicle. It's a tiny follicle. It's more of a scarring Now every woman has experienced it. Now Asian and Caucasian women and other ethnic do not experience it, but black women sometimes only, I would say 10%, 10 to 15% of black women create this one, what they call from a post-hair transplant. There's a little long. It's not true cobblestone. Now cobblestone is when you transplant very thick roots into a small area, and it has a little difference on, so the bump is going down inside, and those can occur Caucasian and Asian, and those could be cobblestone. But for women and black women specifically, it's due to the genetic factors. And it's not cobblestone in that true sense, because we're trying to trim as much hair as we could. However, when we make the site, you form a little base of the scar. It's it's very hard to see, but it's there. Not every black woman experiences it, but on again 10 to 15%. And the other important factor is because the hair, the root is curly, so then it curls. So that's what the other important. It's hard to see, but it's there. And so that, and again, no surgery is perfect. There's always have a good and bad. But the great part is we have a lot of density in the hair. Will cover it, really frame the face better than have no hair. Okay. And this is the art of hair transplant restoration surgery on black woman from Kenya. Thank you.